Welcome to Top Notch Nursing RN. Today we shall cover general nursing questions for Nursing Council of Kenya exam. 1. When a nurse is monitoring a patient for cerebrospinal fluid, CSF, leaky, she should observe for a halo sign, b. Babinski reflex, c. Blumberg sign, d. Allopsoas sign. The answer is halo sign. 2. Following repair of retinal detachment, the priority action is to a. Prevent increased intraocular pressure, b. Maintain darkened room, c. Promote a low-sodium diet, d. Alleviate pain and itchiness. The answer is to prevent increased intraocular pressure. Number 3. When nursing a patient on steroids, the nurse should a. Observe for edema, weigh daily, b. Encourage increased fluid intake, administer antiemetic, c. Encourage bed rest, minimize exposure to heat, d. Maintain infection control, monitor blood sugar. The correct answer is maintain infection control, monitor blood sugar. Number 4. The antidote for heparin is vitamin K, thrombin, protamine sulfate, warfarin, coumadin. The correct answer is protamine sulfate. Number 5. The priority nursing diagnosis for an infant with esophageal atresia is pain, altered perfusion, risk for aspiration, impaired nutrition, less than body requirement. The answer is altered perfusion. Number 6. In nephrotic syndrome, hypovolemia leads to decreased a. Secretion of antidiuretic hormone, b. Oncotic pressure, c. Renal blood flow, d. Secretion of aldosterone. The answer is oncotic pressure. Number 7. While monitoring a child on blood transfusion, the nurse notes that the child has developed chills, fever and vomiting. The nurse should a. Stop transfusion immediately, b. Transfuse the blood more slowly, c. Place child flat on the bed, d. Give antihistamines. The correct answer is stop transfusion immediately. Number 8. Uncontrolled vomiting in a patient can result to a. Tetany, b. Acidosis, c. Alkalosis, d. Hypersensitivity. The correct answer is alkalosis. Number 9. The mode of action of antipsychotics includes blockage of dopamine receptors in the brain, b. Stimulation of serotonin receptors in the brain, c. Blockage of adrenaline and noradrenaline receptors, d. Stimulation of dopamine receptors in the brain. The correct answer is blockage of dopamine receptors in the brain. Number 10. The main cause of edema in nephrotic syndrome is a. Dilatation of blood capillaries, b. Inflammatory processes, c. Decreased albumin in blood, d. Renal failure. The correct answer is decreased albumin in blood. Number 11. A client experiencing alcohol withdrawal symptoms should be given a. Haloperidol b. Lorazepam c. Benztropine d. Naloxone. The correct answer is lorazepam. Number 12. The nurse who threatens to inject a patient if they refuse to take an oral medication is liable for assault, battery, negligence, invasion of privacy. The correct answer is assault. Number 13. The theorist who proposed that nursing is therapeutic interpersonal process is Hildegard Peplau, Jean Watson, Faye Glenn Abdullah, Martha Rogers. The correct answer is Hildegard Peplau. Number 14. A behavior by a student nurse that will warrant intervention by a qualified nurse preceptor is the student nurse reviews the patient's medical record. The student nurse reads the patient's plan of care. The student nurse shares patient information with a friend. The student nurse documents medication administered to the patient. The correct answer is, the student nurse shares patient information with a friend. Number 15. Performing a nursing procedure on a patient without their consent can lead to a civil tort known as assault, battery, autonomy, fraud. The correct answer is battery. Number 16. The stage of nursing process in which the client is appraised for expected outcomes is known as implementation, evaluation, assessment, diagnosis. The answer is evaluation. Number 17. IM injection to an infant should be administered at deltoid region, dorsogluteal region, ventrogluteal region, vastus lateralis region. The correct answer is vastus lateralis region. Number 18. The primary purpose of administering corticosteroids to a patient with nephrotic syndrome is to increase blood pressure, reduce inflammation, decrease proteinuria, prevent infection. The answer is to reduce inflammation. Number 19. A scope of nursing practice is legally defined by the Nursing Practice Act, Professional Nursing Organizations, Hospital Policy and Procedure Manual, physicians in the employing institutions. The answer is the Nursing Practice Act. Number 20. The following feature indicate excessive IV fluid infusion in a 3-year-old child: worsening dyspnea, gastric distension, nausea and vomiting, temperature of 102 degrees Fahrenheit or 38.9 degrees Celsius. The correct answer is worsening dyspnea. Number 21. Nursing's paradigm includes health, person, environment and theory. Concepts, theory, health and environment. Nurses, physicians, models and client needs. The person, health, environment and nursing. The correct answer is the person, health, environment and nursing. Number 22. The nursing model that works best when there are many patients but few nurses is functional nursing, team nursing, primary nursing, total patient care. The correct answer is functional nursing. Number 23. Signs of hypothyroidism include muscle weakness, depression, tachycardia, irritability, decreased appetite, tachycardia, hypertension, somnolence. The answer is muscle weakness, depression. Number 24. A patient with potassium level of 6 milliequivalent is considered to be in a state of hyponatremia, hyperkalemia, hypovolemia, hypercalcemia. The answer is hyperkalemia. Number 25. The process of immersing used dressing instruments in dilute hibitane solution is known as disinfection, decontamination, cold sterilization, chemical sterilization. The correct answer is decontamination. Number 26. The first step in urinary catheterization procedure is prepare fluid to inflate the balloon. Ask the patient to empty bladder. Selection of catheter size. Provide adequate lighting. The answer is ask the patient to empty bladder. Number 27. Following gastrectomy, dumping syndrome occurs as a result of rapid gastric emptying of hyperosmolar fluid and substance into the duodenum, damage of vagus nerve and cardiac sphincter, reduced gastric mortality resulting from vagus nerve stimulation, removal of acid-producing cells thus resulting in reduced absorption of vitamin B12. The answer is rapid gastric emptying of hyperosmolar fluid and substance into the duodenum. Number 28. A classification of ringworms that infects the fingernails is Tinea cruris, Tinea pedis, Tinea unguium, Tinea corporis. The correct answer is tinea unguium. Number 29. Transurethral incision of the prostate is indicated in management of cancer of the prostate. Painful benign prostatic hypertrophy. Benign prostatic hypertrophy causing complete urinary obstruction. Initial stages of benign prostatic hypertrophy. The correct answer is benign prostatic hypertrophy causing complete urinary obstruction. Number 30. The main aim of escherotomy in treatment of full-thickness burn is to remove the dead tissues, improve oxygenation of the burnt tissues, allow underlying visible tissues to expand, reduce pain. The correct answer is improve oxygenation of the burnt tissues. Number 31. A nephrostomy drainage is usually inserted in the ureters of both kidneys. Renal pelvis, nephrones, urinary bladder. The answer is renal pelvis. Number 32. In rheumatoid arthritis, inflammation of the joints begin in the feet, wrist, toes, hip, ankle, elbow, clavicle, hands, fingers, shoulders, fingers, wrist. The answer is feet, wrist, toes. Number 33. Characteristics of first-degree burns include chilling and dry wounds, black appearance, painless wound, erythema and pain, healing by scaling, painless wound. The correct answer is erythema and pain. Number 34. Which of the following findings is suggestive of pneumothorax in a patient with chest trauma? Absent breath sounds, inspiratory wheezing, dullness on chest percussion, pronounced crackles. The correct answer is pronounced crackles. Number 35. The priority nursing diagnosis for a patient with heart failure and pulmonary edema is impaired skin integrity related to pressure, activity intolerance related to pump failure, constipation related to immobility, risk for infection related to stasis of alveolar secretions. The correct answer is activity intolerance related to pump failure. Number 36. The primary reason for administering digoxin, lanoxin, to a patient is to improve the strength of the heartbeat, relax the walls of the heart's arteries, decrease inflammation of the heart wall, prevent irregularities in ventricular contractions. The correct answer is to improve the strength of the heartbeat. Number 37. The sensitivity part of culture and sensitivity test is for the purpose of testing the concentration of antibiotic required to cure infection, identifying the causative organism for the infection diagnosed, identifying the most effective antibiotics against the causative organism, identifying the antibiotics the patient is resistant to. The correct answer is identifying the most effective antibiotics against the causative organism. Number 38. The characteristics of Cushing's disease include hypotension, Kussmaul's breathing, hunchback, mood swings, hypertension, fast wound healing, moon face, buffalo hump, central obesity, flushing, brittle skin, encephalopathy. The correct answer is moon face, buffalo hump, central obesity. Number 39. Swabs instruments and Sharp's count during surgery is carried out by recovery room and scrub nurses, circulating and anesthetic nurses, anesthetic and scrub nurses, circulating and scrub nurses. The correct answer is circulating and scrub nurses. Number 40. Neurovascular assessments of the lower limbs post-cast application involves observation of color, sensation and pulses, level of consciousness, limb symmetry and muscular strength, capillary refill, sensation and muscle power, color, warmth and muscle power. The correct answer is color, sensation and pulses. Number 41. When nursing a patient with chronic obstructive pulmonary disease, the nurse should ensure the patient gets high-flow oxygen rate at 100%. Advise the patient to get influenza and pneumococcal vaccines. Avoid administration of prophylactic bronchodilators. Position the patient in dorsal recumbent position to enhance ventilation. The correct answer is: advise the patient to get influenza and pneumococcal vaccines. Number 42. After a client's nasogastric tube has been removed, the nurse should provide the client with oral hygiene. Offer the client liquids to drink. Encourage client to cough and deep breath. Auscultate the client's bowel sounds. The answer is: provide the client with oral hygiene. Number 43. Barrel chest is a feature of kyphosis, empyema, heart failure, kyphosis, emphysema, osteoarthritis, drug-resistant tuberculosis, emphysema. The correct answer is emphysema, osteoarthritis. Number 44. Indicate whether the following statements are true or false. Colloids are administered in patients with cardiogenic shock to expand circulatory volume. Atherosclerosis is more common in male than female. Colloids are administered in patients with cardiogenic shock to expand circulatory volume is a true answer. Atherosclerosis is more common in male than female is a true answer. All the choices are true. Number 45. The major electrolytes in the intracellular fluid are potassium and chloride, sodium and chloride, potassium and phosphorus, sodium and phosphorus. The correct answer is potassium and phosphorus. Number 46. Factors that can lead to myocardial ischemia include anemia, aortic valve stenosis, polycythemia vera, mitral valve stenosis, anemia, left ventricular hypertrophy, anemia, aortic valve stenosis, mitral valve stenosis. All of the above. The correct answer is all of the above. Number 47. Patients with ulcerative colitis are put on bed rest mainly to reduce falls that can cause massive bleeding, reduce intestinal peristalsis, reduce oxygen demand, conserve energy. The answer is to conserve energy. Number 48. Patients with diabetes mellitus type 1 are at risk of acidosis due to increased metabolism of fatty acids, increased breakdown of fats, increased potassium level in blood, increased myoglobin in blood. The answer is increased breakdown of fats. Number 49. Normal cerebrospinal fluid contain red blood cells and white blood cells. Test negative for glucose and protein. Appears clear and turbid. Appears slightly cloudy and turbid. The answer is appears clear and turbid. Number 50. Nursing interventions for patient with multiple myeloma include providing plenty of oral fluids, providing low-calorie diet in small frequent amounts, catheterization to monitor urine output, encouraging weight-bearing exercises. The correct answer is providing plenty of oral fluids. Number 51. The best indicators that a patient is ready for oral feeding post-bronchoscopy are hoarseness of voice and respiratory rate, bowel sound and cough reflex, respiratory rate and bowel sound, cough reflex and hoarseness of voice. The correct answer are cough reflex and hoarseness of voice. Number 52. The following discharge instruction to a patient following gastrectomy will prevent dumping syndrome. Eat high carbohydrate foods. Limit the fluid taken with meal. Ambulate following a meal. Sit in a high Fowler's position during meals. The answer is limit the fluid taken with meal. Number 53. Patient with compartment syndrome following a fibular tibial fracture is scheduled for which of the following procedure? Escherotomy, laminectomy, fasciotomy, burr holes. The correct answer is fasciotomy. Number 54. Which of the following statements are true about ceftriaxone? Third-generation cephalosporins. Gram-negative antibiotic. Contraindicated to patients with hypersensitivity to penicillins. All of the above. The correct answer is all of the above. Thanks for watching Top Notch Nursing RN. For more update on educative videos pertaining nursing, like, subscribe and share.